So I know you have the low back pain and then also to the left leg.
Mm-hmm.
Can you show me exactly where that is?
Right here.
Okay. So it goes here.
Yeah.
It goes.
So it's, mostly around here towards the end of the day. It's really painful in this area.
Towards the end of the day.
Yeah.
And you also feel it mostly over here too.
Yeah, you know the tendon in here.
Yeah.
Yeah, right here. Yeah. Sometimes here, but mostly.
We're swing down at the right here, which is past our spine. Looks like it's the bottom of that side joint. So it's not really moving here at the bottom of the joint.
It's not moving.
No. Okay. So she has a slightly rotated sacrum on that side, but she has an AS on that side. So we check the legs always with the high low. So if we can look at here, she's way longer. You know, that's really obvious on this side. That left side is a lot longer, you know, by quite a bit. So even though the x-rays actually show that it's shorter on that side, so we'd be really looking at the ASIN on this side versus a sacrum. So your pelvis is actually rotating forwards and pushing your leg down, right? So what we're going to do is actually we're going to kind of do the opposite. Just like that. Okay, so you're going to come a little closer. Perfect. Okay. Okay.
Okay.
So boom, just using that. Right, way different.
Whoa.
So we're good. That's exactly what I wanted. Okay.
Okay.
So your legs are a lot more even into there now.